Hi, my name is Trevor Kingsbury. I'm a biomechanist and the interim lab director of the Clinical Biomechanics Lab at Naval Medical Center, San Diego. Welcome to our virtual Fleet Week tour. In our lab, we have between 12 and 16 motion capture cameras that basically can record the position of the markers that we're putting on the subjects as they move through our lab. We also have 4 force plates in the ground, and those can measure the forces that the patient is putting on the ground. So by capturing the motion and the force data together, it allows us to look at joint angles, powers, moments, full complement of what their body's doing as they're performing different movements. That's really unique because it gives us a lot of data that we can give back to the clinicians, is more focused than what they might just be able to see with their eyes when they're watching a patient walk. So in addition to having the walking lab here at NMCSD, there are running high-level lab up at MCS Miramar, previously at 32nd Street, enables patients who want to run and do high-level activities to also be studied. So one of the key benefits with being outdoors is you have a nice long runway, you can get a normal speed, and we're able to look at all the different components of their running biomechanics, in addition to the walking data that we would be getting in our lab. We also have some mobile on-demand technology that we can bring directly out to the units that we work with, specifically for human performance testing and biomechanical outcomes measurements. So one of the things that we're trying to offer to some of the units that are in the San Diego region is being able to track their technicians and operators and service members as they progress through different training cycles and measuring what their healthy data looks like, and then in the event that they were to become injured, we could use that data to help aid in their physical therapy and their return back to full duty. This is the Intrepid dynamic exoskeletal orthosis, and one of the unique things about this device is that it was developed within the military and is being used almost exclusively within the military for patients who have suffered complex lower extremity trauma resulting in permanent loss of function. So this device almost kind of acts as like a prosthesis for patients who still have their residual, the rest of their foot. And typically patients have a lot of pain, and they're unable to walk and do high-level activities such as running. And this device has been kind of a godsend for them in that it offloads the foot when they walk, and by offloading the foot it reduces pain, which then allows them to run and jump and strengthen their muscles and basically have a higher level of fitness that can help them in their return to duty. So we are fitting probably 50 of these devices a year. We have an orthotist who's specially trained in making and fabricating these devices, and we've had great success with them. The NMCSD Clinical Biomechanics Laboratory's primary mission is to perform biomechanical analyses in conjunction with measuring functional outcomes and quality of life in patients with lower extremity trauma within the Department of Defense. These analyses support the rehabilitation goals of the patient and their return to duty. It focuses on maximizing functional capabilities, which in turn also drives clinical research.